Everyone, good afternoon. Today we're joined by Dr. Eddie Stenehjem to give our weekly COVID-19 update for the community. Eddie, thanks for joining us. It's nice to see you.
Likewise, Amanda. Good to be back.
Yes. As always, I want to start with case counts and go over what's been happening since the last time we spoke. So our total case counts in the state of Utah are 386,550, with today's daily case count at 422, which brings our positive rate to 7.3%. We've had a total of 2,131 deaths, with 6 of those reported today. As of today, there's 138 people hospitalized, and our vaccines are at 1.4 million for the total given. Our first dose, just the first dose, is at 925,628, and those who are fully vaccinated are at 521,686. So it seems like our vaccine numbers are going up, our cases are going down. I want to break that down a little bit more. How are we doing? How are our hospitals and caregivers doing right now?
I mean, we're doing great. This is a time to be optimistic. Our cases are going down. They've really kind of plateaued at a much lower level, kind of back to that level we had early in the pandemic and around September time. Our hospitalization numbers have certainly improved. We certainly still have very sick people in the ICUs and in our regular medical surgical units with COVID-19 that are severe and are struggling, but at much lower levels than we had been, back in November and December. And so, when you look at all of the different metrics you can follow, cases are going down, test positivity rate is going down, as our testing patterns are staying the same. So we're still having quite a bit of testing, hospitalizations are down, deaths are down, and vaccines are going up. I mean, so this is a good spot for us to be currently in here in Utah. I would say though, we need to kind of learn about the other states here in the US. There's plenty of states, actually 30 states now in the US with case counts going up. Maybe not all at the kind of breakneck pace that we had been previously, but there certainly are states out there with very accelerating case counts. I mean, look at Michigan, for example. They've got a case count that's going quite high. So not out of the woods by any means, but man, we're in a much better spot now than we were, 3 months ago.
That brings up 2 questions for you. One is around the spring break. It's spring break right now in Utah and in a lot of places and over the next couple of weeks. Is there any concern that states, like you just mentioned, could start to see this 4th surge happen if people start to kind of forget what they were supposed to be doing or start becoming a little bit more relaxed with those precautions?
Yeah, certainly, especially if those spring break events put people together in close quarters without masks and people kind of drop those kind of public health measures that they've gotten used to, especially overlay on top of that, this variant that we have here in the US, which is, certainly making its presence known, this B.1.1.7 variant that's much more transmissible. Yeah, we could certainly see a rise in cases. I think at this point, though, a rise in cases may look different than a rise in cases that we had back in November, December. I mean, just take Utah, 80% of people above age 70 or older have been vaccinated. So even if we do see this rise, we may see it blunted in terms of hospitalizations and deaths because those vulnerable patients, vulnerable populations have been vaccinated. So yeah, I do think, we do worry about a 4th surge. The timing of this, though, is helping us in the fact that this is coming at springtime where people can get outside, where transmission we know is much less. And, that would hopefully kind of attenuate or really kind of dampen down that potential 4th surge. And if we can hold on, especially here in Utah, and get vaccinations farther down the road, we might be in a really good spot in a month or so.
You kind of just touched on this, but is there anything that people can do to reduce their risk of breakout cases happening as more of us get fully vaccinated? Is there additional precautions we should be taking, or should we be following what we have been following? Any advice for that?
Yeah, I would just say let's not let our guard down. When vaccinated people can get together with vaccinated people per CDC guidance, that's a safe interaction without masks. But if you're starting to mix, vaccinated with lots of unvaccinated with masks off and those types of things, you're going to be at risk. So these aren't new recommendations. This is, let's still be cognizant the fact that there is still quite a bit of SARS-CoV-2 circulating in our communities. It's much better than it was, but there's still, this isn't gone. So I think the biggest thing is, let's not let our guard down too much. Let's continue to doing those efforts that we've done for the past year. I think in a number of weeks, our vaccination kind of penetrance is going to be a lot greater. There's going to be a lot more protection, and we can probably have a little more relaxed public health measures as we move into the summer.
I want to talk about vaccines. There's been a lot of information and data that has come out in the last couple of days around really amazing things that have been happening. The first one I want to talk about is these real world trials that Pfizer and Moderna have reported on, with a 90% efficacy rate against transmission of the virus versus just protection of the virus. Can you talk a little bit more about what those real world trials are and what they mean for the public?
Yeah, so you're going to see more and more of these trials, and they're coming out. They come by different names. They're cohort studies, they're vaccine effectiveness studies. There's going to be a lot of them. New England Journal of Medicine just published 3 different letters that highlight the effectiveness of this vaccine in first responders and healthcare workers. And it's been pretty amazing, the consistency in which these trials have come out, and the fact that almost across all of these, they still look like they're 90% effective in preventing symptomatic COVID-19. So that, that's exactly what the trials show. The trials showed 95% efficacy in both Moderna and Pfizer. And now these real world studies are just emphasizing that they all kind of come in at this 90% effectiveness point, which is just remarkable. That it lowers your risk by 90% of getting symptomatic COVID, and probably even more when you talk about getting severe COVID-19, severity where you'd be in the hospital or on a ventilator or die. And so it is just giving us more and more faith in these vaccines and their protection against the wild type virus in which they were designed, and also the B.1.1.7 variant. And so because of these, we're just really, really optimistic that in our current environment, that these vaccines are such a critical tool for us in society to get kind of back to where we used to be. And so it's been, such a relief to read these reports just showing this widely successful vaccine.
Another piece that was just released today or updated this morning was the CDC's guidelines around traveling if you've been vaccinated. They are now saying that it's safe or okay to start traveling within the US if you've received both doses or the 1 dose of Johnson & Johnson vaccine. Is there any advice for people as the summer starts to get here and people want to start traveling again? What should they be looking for if they're going somewhere, and kind of just what's your overall advice for that?
Yeah, I know, as people are looking to get on planes, and I would highly, highly recommend being vaccinated if you're looking to do any plane travel. That's certainly what the CDC is obviously emphasizing here. A fully vaccinated individual flying is going to be much safer than a non-vaccinated individual. You're still going to mask. Those precautions are still going to be in place. Those aren't going away. But you can certainly feel more comfortable doing that. You're in a tight plane. Most of the airlines now are moving away from their kind of COVID response where they had the middle row empty. They're moving back to full planes. You're going to see many more people traveling. And so being fully vaccinated is certainly going to be much more protection for you as an individual. And I would highly, highly recommend that. Travel around the West, car travel, those types of things, especially in the spring and summer, going down to the desert, beautiful time to do that right now. you're going to engage with other people, whether it be at national parks. You're going to have times where you're going to be pretty close quarters. And so vaccination is just going to make you be able to do that safer. The last thing you want to do is come down with COVID-19 on your vacation. And so just think of this as, travel insurance is getting vaccinated is to make sure that you can enjoy your trip wherever you may go after you've earned it for being cooped up for a year.
I think it's also important to note on that specific piece too, there are certain areas, if you're going to Canada, Mexico, outside of the US, that are still requiring a COVID test when you come back in. Is there a reason for that if you've been vaccinated? Do you know the logic behind kind of wanting to make sure that you're negative before coming back?
Yeah, there's a lot of reasons. One, it's really hard to prove vaccination status. And so from a logistic standpoint, if you're going to say you don't have to test because you've been vaccinated, that gets into then you have to have something to show, vaccine validation or vaccine authentication. And so just one, the logistics is going to be really challenging from that standpoint. And two, the issue is that, it really hasn't been fully elucidated how much the vaccine protects you from getting asymptomatic infection. More and more is coming out to suggest that it's going to have a very significant impact on it and drive that down. But we don't have the definitive data to really say, yeah, it's 90% or whatever it might be. And so I think there's a couple of things built into that. Is one, we just don't know in terms of how effective the vaccine is in terms of asymptomatic infection and thus unknowingly transmit the infection. And then also just the logistics into identifying those people that have been vaccinated.
Another thing I wanted to talk about too was the reports that the vaccines are seeming to be still effective 6 months later. I don't know if you mentioned this previously, but just talking about how it's been, which is crazy, it feels like it's been a lot longer, but 6 months since these trials originally started or finished. I don't know the exact timeline, if you can explain that more and what that means about immunity too going forward.
Yeah, so the report came out yesterday or the day before. Pfizer came out and said that at the 6 month time point, the vaccine still appears to be 90% effective, 92% effective. And so these trials, the vaccine trials would be Pfizer, Moderna, J&J, Novavax, AstraZeneca, all of them are 2 years in duration. And so when an individual participates in the trial, they get vaccinated, they follow them for 2 years. The FDA granted emergency use authorization after 2 months of follow-up. That didn't mean that the study ended. That means that, okay, we reviewed the data at 2 months and the data showed 95% efficacy. That was enough to get emergency use authorization. These trials are still ongoing. And so you're still monitoring all these patients that are in these trials to see how well the vaccine works over time. And so all that report really said was that, we've reported on the 2 month data. Now we're reporting on the 6 month data. And it shows that the vaccine efficacy at 6 months is essentially the same as it was in 2 months. And so that's great to know that one, hey, this is awesome. Still 6 months in, we're showing great efficacy. But it also shows that it isn't declining. Okay. And so it very well could have been that it was 95%, now 75%, still great, but it's a downward trajectory. But this shows it's still consistent. Okay. And so you're going to see more reports coming out from all of those trials. Pfizer, Moderna, J&J, all of them are going to be, probably giving us reports, and there'll be these kind of high level press release reports on how effective their vaccine is at different endpoints. And we're going to have to follow that really closely to determine, is there a need for a booster shot? When is it that immunity starts to wane? When do we need to boost that immunity to make sure we're protected for potentially another wave? So these are going to be really important studies to really understand how long this vaccine will work for us.
You mentioned that these vaccine companies got emergency use authorization. The Pfizer company just announced that they're applying for FDA full approval, official approval for the vaccine. Does that change anything? What does that mean for a common consumer like myself?
No, probably doesn't, change anything at this point. All it will mean is that it's full FDA approval as opposed to just emergency use authorization. I'm sure there's some subtleties in that from a policy standpoint that I'm just not aware of. But at this point, we're probably likely not going to see much change. You could envision, once FDA grants full approval, you could envision more and more companies requiring vaccination for work or travel or whatever it might be because they have full FDA approval. I think that's going to be a little harder to do under emergency use authorization. And so you may start seeing, vaccination requirements start being built into different places once you grant full FDA authorization. That's just speculation, at this point, but you could envision that coming in the future.
It's a good point. And another thing about vaccines I wanted to talk about was the trials for adolescents. Before we get to those specifics, somebody asked us this question and they wanted to know, so with summer fastly approaching us, there's still not a vaccine that's approved for children. What guidelines or precautions should people be taking? Are kids allowed to play together outside? What are your thoughts on that? Masks, no masks?
Yeah, hard question. I think the first thing is that we know that kids can get this infection. We know that kids, for the most part, do pretty well, but kids can also get pretty sick with this. So just to be perfectly transparent, so my daughter got diagnosed with COVID about 3 weeks ago, and she was pretty sick. This wasn't just a kind of a transient sniffle. She had some pretty significant sign or just nasal congestion, then a pretty high fever, and had a fever for about 48 hours, was pretty miserable for those 48 hours, and then had this kind of lingering upper respiratory type symptoms for another 10 days or so. And so, I think it should be highlighted that kids can get sick. Kids can get really sick and end up in the hospital. That's not often, but it certainly can happen. And then it can be a pretty, kind of annoying infection in children that leaves them pretty symptomatic. And so I think it is important for us to realize that this can be not trivial in children. As we get into the summer, I think there's a couple things you can kind of put, as a structure around this. One is that really, really emphasize play outside. We know from studies that the transmission rate outside compared to inside is anywhere between 10 to 20% lower. So really important to get kids outside and focus on playing outside. Then the question comes, well, do you have to wear a mask if you're playing outside? I think if you take the example of two kids riding bikes, do they need masks on? Probably not. It's probably not going to add that much. You're already outside. You're not close together. If it's a breezy day and you're not, super close together in close quarters outside, masks are probably not going to benefit too much. But if you're playing in really close quarters and it's not very breezy or have a lot of ventilation, then masks would probably be useful. And then I think the other thing to think about is, do those kids have high risk parents or grandparents that they're in contact with? And so, just take my example. For example, if I was a liver transplant recipient, for example, I would certainly require my child to wear a mask regardless of where she played. And so I think we kind of have to think through what is the impact to the child's parents and potentially grandparents that they're in contact with, and what is the environment in which they're playing and how many kids are they playing with. So it's going to be challenging as we move forward with this. But I think as all parents get vaccinated and all grandparents get vaccinated, then you can have a little bit of different conversations in the transmission to your parents, and then it becomes, what is the risk to the child and that child getting sick?
Two things for that. I hope your daughter is feeling better. Hopefully she's gotten over it. And my second question around that is, so should you not travel with your children that on a plane if they're not vaccinated, if they haven't been able to get yet? Is there any advice for that specific piece? Yeah,
so the vaccine trial, we'll first talk about the vaccine trials in children. So Pfizer announced that their adolescent trial, which included adolescents aged 12 to 15, that gave results that look very, very promising. And they're actually saying 100% efficacious in the trial, meaning that none of the kids aged 12 to 15 that got the vaccine developed any symptomatic SARS-CoV-2 compared to 18 people in the placebo group. So it was 100% effective. Smaller numbers, 2,000 kids in that trial, but showed a big enough difference quick enough to show that, hey, this is a safe and effective vaccine in adolescents. So I anticipate the 12 to 15-year-old age group, I would imagine that FDA is going to go to try to amend their emergency use authorization to go from 16 down to 12. That's probably going to happen soon-ish. And so I could imagine that, towards the middle of the end of the summer, we could be vaccinating kids 12 and up. And so that will be great. Then yes, absolutely get vaccinated before getting on the plane. When you talk about younger children, everybody's masked. The ventilation is really good in airplanes. More and more adults are getting vaccinated. Again, it's going to come down to what is the risk to that child if they were to get infected. We know that elementary school kids wear masks great. They've done really well. They've proved us all wrong. And the fact that they're very good at this. The preschool age is the tougher age. My daughter's 2.5. I mean, she wears a mask, but how effective is that really? I think that's where you're going to have to kind of adjust your risk profile based on your family in terms of what is the risk to your child and what is the risk from your child to transmit it to somebody in the family.
You also mentioned, we were talking about the younger than 12 clinical trials that are happening. Pfizer's been enrolling people for that. Has any data come out about that age group yet, or is it still too early in the progress?
Yeah, no data on that yet, but Moderna, Pfizer, AstraZeneca, J&J, they're all going to be doing trials in 6 months to, whatever the bottom of their EUA was. But Pfizer's doing studies right now in 6 months to 11 years old. Moderna's enrolling in younger kids as well. We don't have any data on that yet. The data on that trial will be dependent on two things. One is how quickly can they enroll? And so how quickly can they get people to actually sign up for the trial? And then two, what is the community transmission of those places that are doing the trial? If you have high rates of community transmission, it's pretty quick to get outcome events meaning symptomatic COVID-19. If you don't have much transmission, there's not a whole lot of outcome events in either group. So it's going to take longer to see a difference. And so it's kind of to be determined on that, how fast people enroll, and then how much community transmission there is to lead to outcome events to actually be able to see if the vaccine works in those age groups. Dr. Anthony Fauci mentioned this, and who might not agree with Fauci, but I think the fall is probably a time where we're going to potentially be seeing some of these data in the younger kids, which would be great timing in terms of going back to school.
So what is your overall assessment of how Utah is doing in terms of vaccinations and our community herd immunity? Are we doing well?
Yeah, absolutely. We're doing great. And kudos to the state government, Utah Department of Health, and setting up a good system and collaborating with, healthcare organizations like Intermountain and others to get vaccines out. When you look at the vaccines delivered and how many are in arms, the lines go out in parallel. It's really nice to see that we are getting vaccines in, and how much vaccine we get is dependent on federal allocations. But the vaccines we get, we're getting in arms. And so we're doing really well. One of the things that can be a little misleading on some of the national websites that look at vaccinations per 100,000 people is that Utah has a lot of kids, and a larger percentage of our population are children, and they're not eligible for the vaccine. And so you really got to look at, what is the vaccination rate among the eligible population? And once you do that, Utah looks great. We're at, at the top of, the vaccination rates across the US. And so we're doing really well, and we got to keep doing that. And, we really need to make sure that everybody's getting vaccinated. And really focus on the why behind it. And in those people that are hesitant, we need to really explain why this is so important. And I think we're doing well at the moment. We definitely have pockets across the state of Utah, and vaccination isn't kind of universal across our state. We're definitely seeing some places get more vaccines than others. And so we're really going to need to focus on, especially those areas that have hesitancy to get the vaccine, is to really try to do the best we can to educate and get people to understand why we need vaccinations in our communities, to make sure that we can get back to our normal. go back to concerts and do the things we want to do and not wear masks. And so, yeah, I think we're doing well, and we just got to keep doing what we're doing and get more and more people vaccinated.
Another thing I wanted to bring up was our visitor guidelines at Intermountain are changing on Monday, this coming Monday at 8 a.m. We are changing a couple of our guidelines to really reflect those who are in our hospitals who are COVID-19 positive. Eddie, could you just give us a really high overview of those guidelines and why it's important to keep adapting them as we learn more about the pandemic?
Yeah, so the guidelines is going to change to visitors for people that have positive COVID-19. And so if you have a loved one in the hospital with COVID, we're going to allow you to come in and visit that person. If you yourself has had previous COVID or have been vaccinated, you can then come in and visit your loved one that has COVID-19. The reason is we just learn more and more about the vaccine. And so we know that this vaccine keeps you safe and protects you from COVID-19. And we're still going to require you to wear a mask. We're still going to require the patient to wear a mask, and we're going to do things that are going to reduce transmission. We're going to do everything we possibly can to keep you safe. If you come into our hospital as a visitor, it's still our responsibility to keep you safe. And so we don't want to put you at risk, but we do feel, based on the science, that if you've been vaccinated or you've been previously infected with COVID-19, you're safe to visit somebody that has COVID, as long as we continue to follow the precautions in terms of mask wearing. And we're going to continue to evolve our guidelines. We follow the science incredibly closely, and we use that to change our guidelines. And we have a whole team of ID clinicians that does this and reports up to the organization and makes our recommendations and what we need to do from a scientific standpoint. Same reason of why April 10th, there may be the mask mandate is going away from the state standpoint. If you're coming into our hospital, we're still going to require you to wear a mask because we got to keep everybody safe. And we're going to continue to evaluate that, and we'll lift that when the science tells us we're ready to do it.
You brought up my second question, was just a reminder around the April 10th guidelines. And more information about our visitor guidelines will be up on our website on Monday, like we mentioned. We'll also post a link from Facebook there so people can find out. There's a couple other cadences that are changing, but the biggest one, like Dr. Stenehjem mentioned, is the COVID-19 positive patients. Last question for you on that mask mandate piece. If you have any advice for people going forward, Dr. Vento, when I was talking to him, mentioned that April 9th is not different from April 10th in his eyes. What is your message to people going forward after that April 10th date actually gets here?
Yeah, it comes down to just, personal responsibility. I think Governor Cox said this as well, is that, there's not going to be any major difference in terms of community transmission April 10th versus April 9th versus April 2nd. And so I would still say, to protect the community, to protect your neighbors and protect, the people that you see in your community, is to wear a mask. Wearing a mask is simple, doesn't cost you anything. And, going into a grocery store with a mask on, it's just the right thing to do. And so I can tell you, nobody in my family is going to change the way that we think about mask wearing as we are out in our communities and engaging in the communities, whether it be at a grocery store, Home Depot, or at the farmer's market. We're going to be wearing masks, and we'll take the masks off when the epidemiology tells us that it's safe to do so. And so, I think it's just moving to personal responsibility. And I suspect that, people are still going to wear masks. There's plenty of places that are still going to require masks. And, it's just something that it's a sign of us saying, hey, we're doing this to protect our community. And it's the right thing to do. And we'll continue to advise, the community in terms of when, I feel it's safe to take your mask off walking into the grocery store. But at this point, we're still going to do the things that we know work.
I think that's some great advice, and I appreciate the words of wisdom. And thank you, as always, for joining us. And if anyone watching wants to schedule an appointment to get their COVID-19 vaccine, they can go to intermountain.com/COVID vaccine. Our appointments are up for next week if you're interested and still need one of those. We also still have our testing centers available. You can learn about that at intermountain.com/COVID testing. Dr. Stenehjem, as always, thank you for joining us, and we'll see you later.
Thanks, Amanda.
Thanks.